Hi, it's Dr. Fox, licensed psychologist in the state of Texas. And in this video, we're going to discuss BPD and PCOS. Now, we're going to discuss conditions and aspects of medical conditions associated with BPD. Now, BPD features have been linked to the presence of heart disease, arthritis, disturbed androgen metabolism, and obesity. Now, specifically in this video, we're going to focus on the disturbed androgen metabolism, obesity, and obesity-related chronic medical disorders, specifically polycystic ovaries and polycystic ovary syndrome. Now, research has shown that obesity and associated metabolic alterations appear to be linked to BPD as indicated by increased visceral fat and reduced insulin sensitivity in BPD patients. I'm not going to do a deep dive with medical jargon, but I'm going to explain this issue to empower you with insight, to use the information to help you better understand the issue, not feel so alone, and possibly learn more about what's going on with you. So please like, share, and subscribe, and let's get into it. So let's break down BPD and PCOS. Polycystic ovary syndrome is the most common endocrine disorder typically first identified in women in their late teens and 20s, with a prevalence of up to 10%. So you may be saying, yeah, but what is polycystic ovary syndrome? Well, it's a hormonal disorder that tends to cause infrequent and prolonged menstrual periods or cause excess male hormones or androgen levels. Now, the cause of PCOS is unknown. Early diagnosis and treatment, along with weight loss, may reduce the risk of long-term complications such as obesity, type 2 diabetes, and heart disease. Well, what about BPD though? Well, research has shown that BPD is also associated with increased risk for obesity, type 2 diabetes, and heart disease. You were getting that overlap, right? Now, similar issues to those with PCOS and with BPD. Now, if you look at the research or literature on BPD and PCOS, you'll see what is referred to as a metabolic syndrome. Now, a metabolic syndrome is a collection of conditions that occur together, increasing your risk of heart disease, stroke, and type 2 diabetes. Research in the last 10 years has shown that those with BPD are up to twice as likely to have a metabolic syndrome compared to others in the general population. Now, this brings our spotlight back to BPD and PCOS. Now, one research study found that out of 30.4% of women with BPD who were admitted to an inpatient facility had polycystic ovaries, compared to 6.9% who did not have BPD. I mean, this is pretty amazing because this is something that is pretty significant in the BPD population, particularly for females. And we know that the population is not all females, but there is a preponderance of individuals that have BPD and that are female. And we know the reality on the prevalence, just to digress for a second, the prevalence is actually in research studies that have been controlled for prevalence, we have about 52% female and 42% male. So this is a really significant issue and one that's so important for us to know more about. So let's get back to it, which is even further. This research also found that those with BPD had greater concentrations of free testosterone. Free testosterone is testosterone that is not attached to a protein, but we're not going to do a big deep dive into biology here either. So let's stick to the condition, okay? Now, in another study that looked at testosterone in BPD, it was found that those with BPD were found to have significantly raised testosterone level compared to their non-BPD counterparts. Women with PCOS often have an increased level of testosterone. Another study found that women with PCOS have a 3 to 5-fold increased rate of anxiety, depression, bipolar disorder, BPD, and thought disorders when compared to women without PCOS. In addition, BPD and paranoid personality disorder were examined together and found to be significantly higher in women with PCOS compared to women without PCOS. So what does this tell us? It tells us that hormones are highly related, that they are impactful to these individuals with BPD. So we have to be aware of it. We have to pay attention to it. That's why we're doing the video, so you know more, learn more, understand more. Also, there was another research study that also found that women who were diagnosed with PCOS many years prior to BPD experienced multiple acute psychiatric hospitalizations, poor quality of life, and eventually functional disability. Now, if diagnosed early, patients with PCOS can have better quality of life and improved outcome. Clinicians who treat women with PCOS should be aware of the psychological and physical consequences of the condition. Also, patients with PCOS should be routinely screened for BPD. As always, it's important to present a positive, respectful, and empathic attitude to understand women's worries and the needs associated with the diagnosis of PCOS. And it's critical to put all of these things together to increase the awareness as a group, as an individual who provides information about BPD. We should talk about those intersecting medical conditions that are so important. And this might be something that you're contending with and something that you're dealing with or something that doesn't feel right, and going to your doctor and being upfront. Sometimes we have to be advocates for ourselves and be assertive, not aggressive, where we're demanding things, right? And not passive, where we're just taking it, and whatever they say at face value, but being assertive for speaking up for ourselves. And that's important. The assertiveness part is often difficult for folks with BPD because a lot of times when doctors, even mental health, medical providers see that diagnosis of BPD, they can make some assumptions, right? And they can be skewed towards the negative. And there can be what's called confirmation bias, which is that we see in the environment what we believe is present, regardless of the reality or not. So we confirm it in the behaviors that we see. There's a higher preponderance or likelihood to identify those behaviors, even though they may not be there to the same degree. So ultimately, what I want you to do is I want you to advocate for yourself. Know about your health. Know about these intersections of these medical conditions. I'm happy to do more videos on these medical concerns and the biological aspects. If you're interested, leave it in the comments. I would love to hear that. So please like, share, and subscribe. And I'll see you next time. Thanks. Bye-bye.